Hi everybody, my name is Dr. Zha. I am a physician at CBHA. I'm also the physician liaison on the task force against coronavirus.
Hi, my name is Jude Alsarraj. I have a PhD on molecular biology, and I've been working here at CBHA for a few years now, and I'm working with Dr. Zha on the clinical task force for coronavirus.
So today we're going to be asking some questions and answering some questions that are common out in the community, maybe debunking some myths out there too, if that helps you. So
I can start with the first question, Dr. Zha. So coronavirus, is it just like the flu?
So the initial symptoms of coronavirus and influenza are pretty similar. You have fever, cough, and fatigue. Both influenza and coronavirus can both be mild, moderate to severe. However, the overall profile of the coronavirus is more severe. So the estimation of the mortality varies wherever you read it, but the mortality rate seems to be between 1% to 3%. Meanwhile, the influenza virus infection mortality rate is a lot lower than that, probably by a few times.
So Dr. Zha, everybody says that they can die from coronavirus. Do you think they can really die from it, or is it really that deadly as everybody's thinking?
Not everybody who gets coronavirus dies from it. In fact, we do have some data from Washington State. Out of the 3,400 people tested, only about 90% of these tests are actually negative, which means that even if you have respiratory symptoms, most of the time you do not have coronavirus at this point. We do also have data from China, large data from CDC of China, showing that about 81% of coronavirus cases are actually very mild. In fact, out of the 81,000 cases that are confirmed in China, about 62,000 are actually fully recovered. I have some question too. So is it true that children cannot catch coronavirus?
No, this is not true. So children can catch coronavirus. Their symptoms will be not as severe. So usually they would they will catch it, but they wouldn't be as sick as people of older age or people who are more having underlying conditions or stuff like that.
Mm-hmm. Yeah, I agree. So older adults, especially people with comorbidities such as any kind of immune compromised stage like diabetes, rheumatoid arthritis, if you're on chemotherapy, if you're chronically sick otherwise, are at higher risk of mortality and even the severity of the disease.
So would COPD and asthma be one of
the
underlying?
COPD and asthma, yes.
Right, that would be one of the underlying.
Yes.
So we just have to be careful with those older ages.
Mm-hmm.
But children do get it for sure, but their symptoms are not as severe. So you hear this question a lot. Patients are asking, everybody's asking, should we wear a mask when we leave the house even if we are not sick?
No, you should not be wearing a mask if you're not sick when you go outside. It's a different recommendation if you are actually sick. If you do have cough, you should be wearing a mask when you go to the public. And if you are somebody who is in healthcare taking care of people who are sick, then you should definitely be wearing a mask. There are some recommendations out there saying that perhaps if you're not sick and you're wearing a mask, that increases your risk of actually wanting to touch your face. We know that exactly.
Right.
Yeah, we know that coronavirus can survive on surfaces other than just the air for a pretty long time, and this is new data that we have. So touching things and not disinfecting things gives you a risk to contract coronavirus as well. So if you are somebody who wears a mask and wants to adjust and feel like you have to adjust your mask all the time by touching your face, that probably gives you a higher risk of contracting the virus. And the CDC recommendation for healthcare provider who do wear a mask is actually that they have to simultaneously be disinfecting, wash their hands frequently. So another common question out in the community is that garlic or certain foods can help prevent coronavirus. Is that true?
Garlic actually has really beneficial antibacterial properties. They're talking about onion, if it's also helpful. They do have good properties, but they definitely don't protect against coronavirus. There is really not enough research showing that these garlic or onion or even any other food will really help against coronavirus. So boost your immune system. Eat things that are really good for you, for the immunity, raise your immunity, but it's not necessarily protecting you from coronavirus.
keep yourself hydrated is a good measure anyway.
Right.
Yes.
Hydrate.
Yeah. Another
Exactly.
popular question is that you can catch coronavirus from eating Chinese food or touching goods that are shipped from China. And some people think that coronavirus came from China where people ate bat soup. Is that true?
This is not true. So you're not going to get coronavirus from eating Chinese food. And bat soup, I don't know. I never tried it. I never heard of it. But there's really no evidence that there is any soup, Chinese soup or bat soup or any kind of food will give you really coronavirus. Now, in terms of the packages and the goods that you get, there's really not enough evidence that letters can carry the coronavirus and survive for that extended time. So we just have to wait for research and see what it is, but it should not be, infecting your food or packages or anything like that.
Yeah, I like to point out that we're all in this together as a human race. If you do know some people from China or your friends are from China, send them compassion instead of criticism, because if the virus does not discriminate against what race you are, what country you're from, we should not be either.
So my next question, Dr. Zha, is if I get sick with respiratory symptoms, should I come to see a doctor at CBHA? Schools are recommending go see the doctor, you're coughing or you have URI symptoms. So what are your thoughts on that?
So at CBHA, we're always happy to see you. However, this is a special time. We are trying to encourage people to call us first before they come in if you have mild symptoms. This is because we want to protect the public against people who are really sick in the clinic at this special time. So sometimes when you call us, we're able to consult a provider. We might be able to consult them and prescribe you medications on the phone as well. CBHA has also implemented a policy where we're separating respiratory infection patients from those people who are coming in for other reasons. That way there is some separation and protecting you against infection. At CBHA, we are committed to taking care of you and keeping you safe at the same time.
So let's talk about testing now. So is there any testing available for coronavirus here at CBHA?
Yes, we are working very hard to increase our number of availability for testing here at CBHA. However, it is the recommendation from CDC as well as the State Department of Health of Washington to test those who have high probability of actually having coronavirus or those people who have severe symptoms.
And this is really not a CBHA decision, correct? Yeah, this is like unofficially from CDC and Washington State Health Department.
The recommendation might change as we have wider availability in the country to test people for coronavirus, but that's just not where we're at right now.
So if a patient tests positive for coronavirus, so how will CBHA help this patient or any other patients who test positive?
Yeah, that's a good question. So at CBHA, we are prepared to deal with possible cases. If you do contract coronavirus and you have mild symptoms, more than 80% of the time you will have mild symptoms at this point, and most people who have mild symptoms will be able to recover at home. CBHA will work with the State Department to help you through that process. We'll help you self-monitor every day to make sure that you can recover at home. But if you do have more severe symptoms requiring hospital stay, we also have a process implemented to help you get to that point.
Great.
As you might know, there is no cure for coronavirus. Just like most viruses out there, we do not have a cure for. Therefore, it's more important for us to pay attention to preventative measures. And if we, as well as the State Department, make a recommendation for somebody to self-quarantine or isolate at home, even if you feel like you are getting better or completely recovered, we recommend that you follow those recommendations to the day that we recommended. This is because viral shedding or infection or transmission can happen even when you have no to mild symptoms. So it's really important for you to protect the rest of the community as well.
So thank you, Dr. Zha, for answering all these questions that I think everybody is wondering about, and there's so many questions, I'm sure, in the community that we can also answer.
Yeah, thank you. And hopefully we can update you soon with another video updates with facts and data-driven research.
Right, and you can find a lot of information on our website, cbha.org, and see you soon.